Mohan, the Executive Director of Soma Medical Incorporated. Welcome to the show.
Thank you for having us here.
Right, okay, before we go into your products and your innovations, let's talk about both of you. Probably a little bit on your background, Leonard?
Well, I got involved in indoor air quality assurance about 18 years ago. We started developing equipment based on the fact that Professor Dr. Ranbir Kulse, at the time he was a professor, had told us that there is a lack of expertise in this area of indoor air quality here, and he offered his good services for clinical trials to be conducted from any equipment that we can develop, or rather bring into the market for testing.
Okay.
And subsequently we opened up Soma Medical, invited him to be a partner of the firm, and we started developing our own range of UVCs, HEPA filters, active carbon filters.
Right, which we will discuss later.
Exactly.
Right, and how about Mr. J. Mohan?
Yeah, I came into association with Soma Medical in 2007.
Okay.
From 2007 we worked together, and I really wanted to take it outside Malaysia. So I started this business in India, where it is at a very nascent stage. People didn't realize what is indoor air quality and things like that. People were talking about purification of water, but purification of air was not relevant at that time. And then we slowly started moving into hospitals, talking to them about how their internal air quality can be improved, whereby the infection can be controlled in the hospitals.
Right. And let's talk about Soma Medical right now. So what is Soma Medical and what does it provide, Leonard?
Actually, the caption that we have, our company does give you a very clear message what it's all about. It looks like this, by the way, our brochure.
Oh, you can hold it up. Yeah.
It looks like this, and this graphic illustration that you see right now was deliberately done in this manner to attract the attention of the public. We found that whenever we place this brochure on a table, the public are very curious and they always pick it up. And our caption line really tells you exactly what Soma is all about. It's all in the air. If you knew what we know about indoor air, you stop breathing completely. I mean, we had to get this message across because a lot of people do not understand that indoor air is actually highly contaminated. In fact, 90% of the time we found out that indoor air in different environments are very polluted.
I see. And this includes our house?
Yeah, exactly. Exactly. Includes our house, the factories, offices, so on and so forth. And in the course of finding this information, we went on to look at the guidelines given by the Environmental Protection Agency. And surprisingly, there are actually guidelines given by EPA, CDC, Center for Disease Control, NIOSH, DOSH, and all of them seem to speak the same language. They have advocated 5 different technologies to be used either individually or to be used in unison to address any indoor air quality problem. So we started developing our own products based on these 5 criteria given by EPA. If you'll allow me, I'll just briefly tell you what these 5 criteria are. Basically, they wanted particulate filtration methods to be done, meaning HEPA filters. These are the 5 methods advocated by EPA. Yeah.
Probably you can read it out loud.
Yeah. The first one being particulate matter, which is HEPA filtration. The second one being gas phase air filtration, commonly known to most people as active carbon filters to remove VOCs from the air. Ultraviolet germicidal irradiation, UVGI lamps, to kill or to alter the DNA of bacteria so that there is no replication. Photocatalytic oxidation, this is a kind of a chemical we spray on the wall to prevent surface decontamination or other surface contamination. And then air ionization. Now air ionization is basically we're trying to increase the negative ions in the air because scientific evidence has shown that if there's a high concentration of negative ions in your indoor environment, your health improves.
Okay.
Your concentration improves.
Right.
In fact, there's a whole load of benefits. You can find this all by just googling benefits of negative ions
Okay.
in the internet.
So, okay, let's talk about the products and services that you have in Soma Medical. Probably Jay?
Yeah, we are. Our core focus is hospital.
Okay.
Has been hospital.
Okay.
But later, whatever we have been supplying to the hospital is now being offered to the general public.
Right.
So let me just give you a brief about how we have addressed some hospital infection problems using these technologies.
Okay.
Bacteria, viruses, spores. But out of these, spores are very difficult to eliminate, and theatres become defunct. People close down the theatres because when spores attack,
Okay.
there are very few chemicals, or very
That can kill.
that can kill the spores, remove spores completely.
Okay.
Because spores can cause sepsis. That's blood.
Right.
It can enter your blood system
Yeah.
and poison it.
Mm-hmm.
So we have opened up defunct operation theatres
Okay.
in these
Open up.
emerging markets.
Right. With the products that you have.
Yeah, with the products we have. We have totally eliminated spores.
Mm-hmm.
Then bacteria and viruses are not a big enemy for our technology.
Okay.
So that has happened in hospitals. And let's take the case of an ICU,
Mm-hmm.
where patients are there. You can't remove the patients when you have a sporal attack or viral attack. Obviously you have to, but we have our technologies are preventive in nature. Once you do the antimicrobial coating onto the surfaces,
Okay.
it stays there permanently. It gets impregnated on the surface, and it's just a catalyst. It doesn't get used, so it doesn't get exhausted. It's just there.
Okay.
And using this antimicrobial coating, we can have your ICU sterile, and it takes care of the air and the surface.
Right.
So whether it is virus or whether it is bacteria or spore, a simple principle is oxidization.
Right.
So once it oxidizes, it eliminates.
Right.
And it eliminates not only the spore, even the endotoxins, what are left by the dead spores.
Okay.
So that's where we have started. That's our strength is. So that's a critical area where we address hospital, operation theaters, ICUs.
Right.
Then you come up to any indoor living space can also use the same technology.
Okay.
So it's actually today we are blessed that what technologies we have given to the hospital
Can be used in
can be
houses
used
and
in the general,
offices.
yeah.
Okay. I think the public needs to know more about the products and services, and we do have a clip on the products that you have, where we went to your office and we took some visuals over there. So let's take a look at the package right now.
Soma Medical, we deal with indoor air quality, and also we have products to ensure that you have a good indoor air. Our niche product is based on the 5 technologies by the EPA. Okay, first one is UVC, second one is the filters, and third one is the machine that have all the 5 technologies recommended by the EPA. And the reason is our product works because of the technologies recommended by the EPA, and it's cost efficient. As we know nowadays, haze is very bad outdoors. People feel that they are safe indoors, but they don't know that indoor is also polluted by different type of pollutant. For instance, the everyday things that we use, such as the air freshener, and also our perfume is containing VOCs as well. This is titanium dioxide solution. We can use it to anywhere in the house. You can put it on the wall or the fresh paint. It will also purify into the air.
So, in this solution, do you wipe it on the wall?
No, you spray it.
Using this?
Yes.
Is it permanent? How long can it last?
It will last for at least 5 years. Most operate the filter. So this is how it looks like. This one. This is one of the filters recommended by the EPA.
So where do we install this?
This is actually inside our machine.
Oh.
And thirdly is the magnetized air media filtration.
Okay.
This is also installed inside our machine.
So what is the specialty of this filter other than other brands?
This filter is actually rated 16. This filter can filter bacteria and also items as small as 0.03 micron.
With the haze problem and air pollution getting worse day by day, we often take for granted the air we breathe indoors. But fret not, Soma Medical has the perfect solution to ensure the air we breathe are free from harmful particles. I'm Putri Mahira for Biz Talk.
Right, and that was an interesting package that we just saw, but we have to go for a short break, and when we come back we elaborate more on that right here on Biz Talk.
Catch Bernama Today